There really wasn't much that I could do at all. I couldn't even go for walks. People would invite me to things. I wasn't able to do much. I complained so much that, I think people didn't enjoy being around me that much, and they didn't invite me to things. I was kind of isolated, really, because I couldn't really participate in many things that people did.
My deconditioning prevented me from driving far distance. Even driving short distance, I would have to put the car in park at a stoplight. It was a time that made me very uncomfortable and fearful. The deconditioning led to limitations of walking, needing wheelchairs, needing electric scooters. It was not a life that I was wanting to live.
I just remember living day to day and moment by moment, um, trying to control the pain through medicine. And it was just, it was difficult. Every little thing that I did was just miserable. And I couldn't do the things that I really enjoyed doing. I was really big on golfing and running, playing basketball, football, things like that. Very active person, and those things I just couldn't do anymore.
Pre-activity level was not great.
I was using a cane to walk most days. I was bedridden most of the day. I had one in VPK and a little one in kindergarten, and so I'd be up to the school to pick them up. But when I wasn't like having to be up to do the majority of just normal life stuff, I was either in bed or sitting on the couch. I wasn't active at all.
Before going to PRC, I was not very physically active. I was a lot of times would cancel social events, would not want to go to work, would not want to really get out of bed.
My activity, I was very unreliable. I was incredibly unreliable. Yeah, my pain, my challenging days dictated my every moment. And I was, there was no schedule. The schedule was whatever I felt that day.
I was not exercising. I did not have a healthy diet. I was working, but it was very spotty. Like I was late to work a lot, or I would, be having problems at work a lot because I wasn't very, my functionality level was not really where it needed to be able to hold down a job, especially in the teaching field. You have to be the responsible adult in the room. So, when you're not feeling well or you're having symptoms, that can affect you in a lot of different ways. So, and clear-headedness too. Don't want to leave out, I was on, an array of different medications, which also I think attributed to the functionality problem.
I was a push crasher. I would do until I couldn't do anymore.
It really changed my life drastically. I was able to do a lot of things, and I was off medications. I didn't have the side effects. I was able to sleep, without medication. It's pretty amazing. I hang out with people. I actually can ride a bicycle, which I do regularly, in fact, something I couldn't have dreamed of before. I thought I'd never be able to do that again. So, it's been much better. It's quite different from what I thought I'd be able to do. I thought I wouldn't be able to, live a normal life before, but it's been nice. And I'm really grateful to the program.
After pain rehab, I developed a plan to exercise. I had never exercised in my entire life. And that gave me the motivation and the wherewithal to know how to deal with what my body was throwing at me. So learning to strengthen my body through resistance training and weights, having a schedule, learning how to properly moderate cardio and start with gradual exposure to exercise. really helped me gain strength and ability. And it wasn't overnight. The program was 3 weeks, and a lot of work still had left to be done. And I continued to do that. Coming up on the 2-year mark, I've gained strength. I'm driving. I am walking in stores with my 21-year-old daughter. I am able to do things that I was unfortunately unable to do, something as simple as walk down my stairs of my house or walk up my stairs. It got so bad where I couldn't stand at the bathroom sink to brush my teeth. And of course, now all of these things that one might take for granted, I'm able to do again because of the program.
So I've been doing the things that I haven't been able to do for years. I'm just now being able to do in the past couple years, and it's purely because of what I learned at the PRC.
Several of the components of the program just emphasized the functional component of your life and not necessarily your feelings. By improving my function and improve my feelings about things and life. In my group, various people had various stages of physical difficulties. They're very encouraging with physical therapists and occupational therapists to get you back in some form of condition and with a life plan to make it after you leave the Mayo Clinic. I followed that approach, been very happy with that. My functional level improved significantly. And, I'm not just talking about the physical component, I'm also talking about the behavioral component, the emotional component, the chemical component to my system. So my functional level is significantly changed in a very, very positive way, which has been observed not just by myself, but everyone around me, including work and family.
And now, what? I am in the gym 3 to 5 times a week, and I barely take rest breaks. Now on cloudy days, I've moderated and I know how to, be flexible, but I have learned how to just do this life, and I'm at a level where I never thought I would be. So I'm up, I'm moving. I'm even actually working on getting a standing desk, which back before Mayo, that wouldn't even have been a thing. I've been like, no, how can I sit and be comfortable? And so, yeah, my activity level is on a whole nother level. Like, I think before I came to the program, I was probably at a 0, maybe a 1 with activity level. And now, I'm at like a 10. Like I'm pretty active, more active than I ever thought I would be prior to the program. And so I'm just so grateful.
Coming back to reality with everything I learned, but I would say after about month 2 and 3, I was a totally different person. I was excited to wake up in the morning. I was excited to do my exercises. I was excited to move. I was grateful that I could move. And I was back to being very social. I even changed jobs. I realized through that time that the current job I was in didn't really fit who I was coming out of PRC. And so I got a wonderful new job, and I actually stayed there for 7 years after, and really was just back to being my old self.
Just in those 3 weeks, it was incredible. I was back on my feet walking around, something I hadn't been doing a lot. I was lifting again, something I hadn't done in like a year and a half. I was confident. I felt great. I had a schedule because of the program. It taught me how to keep a schedule. I was sleeping. It was emotional. It was emotional in the growth just in that time, and how Mayo taught me how to manage my symptoms. And that growth, I know it's different for everyone, but personally for me, it continued. And it's been 2 years since I've been out of the program, and every year it's just been growth. It's crazy. The things I'm able to do today, I thought I would never be able to do again. I'm forever grateful for Mayo. Saved my life. I'm
working full time. I'm I'm on time every day. I don't have to call out sick for any reason. Even on a difficult day, I'm still at work. I'm still functioning. I, through PRC, have learned to function in a way that is conducive to what my needs are.
I am able to be in my friends' weddings. I'm able to go shopping without problems. I'm able to go on walks every day without feeling like I'm pushing through something just to accomplish a task. I enjoy it, and I feel like I'm able to function so much better to where I feel better because I'm doing more.
To put it bluntly, it was really life-changing. I was completely free of medicine for one after the program, and so much of it was counterintuitive, but the messaging was to get up and get out of bed. And that's what you did in the program, and then that's what I carried on to do. So it went to a lot more activity and really forcing myself to get out and then going along other program guidelines. And it was life-changing for me.